Donald Trump has struck again. His trade war has a new target, pharmaceuticals. That is the target. Starting October, drug imports will face a 100% tariff in the US. Just like his earlier moves, this too hits India. The US is India's biggest pharma market, but most of the exports are generic drugs. The new tariff does not apply to generics, but there's a catch.
शायद कल जो एक नोटिस आया था सोशल मीडिया पोस्ट पे हम लोगों ने देखा है कि नए टैरिफ की बात हो रही है फार्मा पे और भी अन्य कुछ पदार्थ पे। तो इस रिपोर्ट को हम लोगों ने देखा है और हमारे यहाँ जो मंत्रालय जो विभाग इससे संबंधित है वो इस मामले पे नज़र रखे हैं और उसको उस पर देख रहे हैं कि क्या उस पर असर पड़ता है। विशेष जानकारी के लिए तो मैं कहूँगा कि जो संबंधित मंत्रालय हैं यहाँ पर उनसे बातचीत करेंगे तो
So let's break it down for you. First, what exactly is this tariff on? Trump is targeting branded and patented drugs. As always, he made the announcement on Truth Social. Trump said, and I'm quoting, any branded or patented pharmaceutical product will now face a 100% tariff. There is one exception though. It's for companies that make in America. If you have a plant in the US, if you have broken ground, or if your factory is under construction in the United States, then you can be exempted from this 100% tariff. Also exempted are generic medicines. And the reason is quite simple. A tariff on generics would be counterproductive. They are consumed in large quantities. In fact, India makes up 31% of America's supply of medicines. Last year, this export was worth over $8 billion. And generics are essential for any healthcare system, including the American one. These are the most commonly used drugs, and they help in saving money. In 2022, generics saved the US economy some $219 billion. So you could say that India can help America keep its healthcare affordable, which is why generics are exempt from the latest tariffs. But they're still being targeted with a different tool. Washington has ordered an investigation. The scope of this probe is very broad. And the question it is trying to address is this. Do pharma imports pose a threat to US national security? That's what they will investigate. Do pharma imports pose a threat to US national security? The review covers finished drugs. It also covers active pharmaceutical ingredients, or APIs as they're called, and other medical materials. The US Department of Commerce is leading this probe. The report will be ready by December. The recommendations will be submitted to the US President, and President Trump could take action by March 2026. Now, for Indian suppliers, this probe poses a risk, which is why markets reacted sharply to this announcement. Major Asian markets were trading in the red today, from South Korea's Kospi to Hong Kong's Hang Seng, Japan's Nikkei 225 and India's Nifty 50. They were all in the red. And this was predominantly due to the losses suffered by the pharma companies. The trades were mostly sentiment-driven because while generics are safe right now, investors are not sure about the future. So where does this leave Indian companies, the ones that supply drugs to the US market? For now, the direct impact is limited. Only a few Indian players sell branded drugs in the US, but Trump is sending a deeper message, the same one that he has sent through other tariffs. He wants you to make in America. He wants you to invest in America, build more factories, more manufacturing facilities. And global pharma giants have already started doing this. They are building new plants. They're expanding their base in the US, and that poses a long-term challenge for India. The success of Indian pharma was built on two factors: low cost and scale. Indian companies produce good quality drugs at scale, and they do it at reasonable prices. But this model is now under threat. To keep their market share in the United States, they may have to build factories in the US, and that means higher costs and thinner margins. Big companies may survive this, but smaller firms could struggle. So what is the way out? Well, a trade deal could help. India and the US are talking again. If they strike an agreement, if pharma is included in the pact, then these tariffs could be capped. But with Trump, there is no guarantee. Remember, this is not an isolated move. The pressure is coming from many sides. In addition to the 50% tariffs on Indian exports, Trump has revoked the sanctions waiver for Chabahar port. He has imposed a $100,000 fee on the H-1B visa, and now the pharma sector is under attack. Trump is clearly turning up the heat. Yes, India will feel the impact, but so will the US. Because these latest tariffs target medicines. Many of them are life-saving drugs, so the real cost may not be borne by Indian companies alone. American patients could end up paying the biggest price for their president's reckless moves.
Firstpost now available in 9 languages on YouTube. English,
Stands at $36 trillion.
French,
Le FMI, comme
German,
Geschäftsführenden Direktor,
Hindi,
$30 trillion ka karj mo.
Indonesian,
Pemerintah tanpa pemeriksaan.
Italian,
Sekali radikali.
Japanese,
$4 trilhão idioma.
Portuguese,
Por causa do próprio balanço patrimonial.
Spanish.
Beautiful bill.
Go to Settings, click on Audio Track and select a language of your choice. Be the first to know what's happening around you in your first language. Firstpost.